answers. Then some are not going to participate. Then now we're going to start answering it together. Just you honestly mark your paper. But that you cannot cheat yourself. Okay, then everybody knows where he is actually. Okay, what you do it. What you did. Time, let's start backward. What's the diagnosis?
DVT.
DVT. Cellulitis could be unilateral, but mainly شديد vein thrombosis. Okay. طيب. Confirmatory test.
Ultrasound Doppler.
Ultrasound, but I will do D-dimer before it.
لا.
Ultrasound.
Confirmatory test.
Doppler ultrasound.
Doppler ultrasound. يعني not ultrasound gray scale. Doppler ultrasound. أو
CT angio.
لا CT
Doppler ultrasound.
أو
Clinical.
لا no. Confirmatory test. Clinical already we have swollen unilateral leg. It could be cellulitis still. What other tests we do? Venography, shabab. Venography. Okay. Doppler now because it's less invasive. That's why people do Doppler ultrasound.
اللي نكتب دوبلر خطأ.
Doppler is okay.
التراساوند.
Ultrasound no.
Ultrasound
لازم
Doppler.
Doppler ultrasound. Ultrasound معناها انت are talking about just the gray scale ultrasound. It could help if you see a thrombus inside, like it doesn't confirm anything. Okay, few criteria for gray scale ultrasound to be used for, usually you're not looking for lower, usually for pelvic veins. You can't see this thrombus, then you ask them to do what's called Valsalva maneuver. Then usually you're going to see if it's not a deep vein thrombosis, then you could see an expansion distal to it. Usually nobody is doing it because it's still young gray area. Either you do Doppler or venography. That's confirmatory test.
دكتور الفينوغرافي اكس راي with dye ولا
You inject a red dye, then you see you see
CT
the
or X-ray.
circulation. Exactly. It's an X-ray.
اكس راي.
Okay. Confirmatory test is venography and or Doppler ultrasound. Any answer other than this is not true.
طب اللي
يعني-
حط التراساوند بس.
No.
طب وانا نص درجة.
Okay. What you give yourself. The point is, other tests ممكن you can't do like coagulation profile test, testing for thrombophilia, D-dimer, but these are not okay. Complications. If one complication حيكون شنو؟ pulmonary embolism number one.
ايوه.
Okay. Pulmonary embolism and this. Okay. تاني.
ماسف بي.
لا pain
Pulmonary embolism.
pain and
Pain is presenting symptom.
مرض complication. والريثميا دكتور الريثميا.
Varicose veins no. It's not
Arrhythmia.
varicose vein is a risk factor for deep vein thrombosis.
كوس هنا.
الريثميا دكتور.
If they shot an embolus طيب okay. تاني. They die if it's a big thrombus. Okay. Ischemia of the limb itself. Okay. Limb ischemia, amputation. Okay. الحاجة الثانية insufficient for the valve of the veins become ineffective later on. End up with varicose veins. Become more severe. أيوة.
يعني بريكوس فين صح.
Yes. Okay. طيب. Clear? طيب. Give yourself true. هنا feature of malignancy we see there is an arrow pointing
solid.
solid component. Other features شنو؟
protruding
ها؟
في projection.
protruding or projection.
projection وين؟
في فوق.
Regular border.
This the mass.
No. The mass itself.
This one?
أيوه.
Okay, finger like projection type. Okay, solid mass تاني. Solid and cystic component. تاني what else other of malignancy ultrasound? ما is not asked here. Multilocular تاني. لا ما other. Not here.
Multilocular. The wall of the septum is thick.
Thick wall.
Finger-like projection.
Bilateral.
Molecular.
Ascites. Okay. Ascites.
طب هنا وش يعني وش نكتب؟
هنا is solid component. Here just that's an off record question and other features. These not asked here. You just the only thing here the arrow solid component here.
So
Yes.
if I write solid only.
خلاص صح.
It's okay. You give yourself that mark.
What's
Okay.
the possible clinical presentation?
Clinical presentation. If somebody's having that
Pelvic pressure?
Mass.
pelvic pressure,
Pain?
pain, this one,
Mass.
لا 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 bleeding.
bleeding, how?
Weight loss.
Later on weight loss. Okay.
Infertility.
disturbing
Ovarian mass. No,
menstrual
you
cycle.
can't see female pregnant with ovarian mass.
disturbed menstrual cycle.
No. This
ولا pain ولا شيء.
ايش قلنا pelvic ايش؟
لا كده دقيقة واحدة.
pelvic ايش؟
No, I'm talking about clinical presentation. يعني symptoms. What do they complain? Somebody having ovarian mass. What's a complaint? What's majority? الغالبية what's the presentation? I gave it the lecture.
إيه عارفين.
لا, then I know what I say.
We know.
Huh? Clinical presentation.
Mass.
Mass late presentation.
Pelvic pressure is.
Pelvic pressure, the majority asymptomatic, usually discovered by accident. Okay, then later on, they come with mass,
صح.
tiny,
Pain.
pressure symptoms, either frequency of urination or constipation. Loss of appetite, nausea and vomiting features of advanced malignancy, usually it's very late clinical presentation. If you mention it, it's okay, it could be right, but usually it's a late. Always, what's the most common presentation? طبعا في حاجة واحدة, when somebody asks you something, always the most common thing come first. يعني don't come هنا. طيب, when do they come with pain? لو حصل شنو? If they have torsion
Hemorrhage.
or hemorrhage. Okay, يعني what people call ovarian accident. Okay, torsion or hemorrhage. Then they come with pain. Otherwise, usually they are asymptomatic.
يعني
Okay?
دكتور pain صح ولا غلط؟
Pain معنا. Don't give yourself anything. How to
calculate RMI اللي هو ال CA 125 CA 25 والمينوبوز والبريمينوبوز وال
خلاص خليه يكمل. يس.
هو ثلاثة.
ايش ايش؟
الترا ساوند فايندينج في CA 25 في المينوبوز او
طيب, menopause, how you give it, how you calculate it?
إذا كانت reproductive 1 و3 إذا كانت menopause.
If she's menopause 3, pre-menopause 1, 5, ثاني.
الالترا ساوند if she have one like this هنعطيها 1. if she had more of 2 or to 5 I will give her 3.
Okay, good.
ال CA 25 he will give me
وإذا كانت فوق ال 200 تأكل.
yeah cut off.
It's malignancy, most likely.
هذا اللي جاوبته.
كويس. طيب. Names. What is this one?
The blue line estrogen.
It's an estrogen.
Yes. Source of it follicle granulosa cells.
It's all of it throughout follicles.
لا في على حسب بس
دقيقة
هو
واحد. Yes, leader.
Most of it before the ovulation from the follicle. And then I think from the ova itself.
Okay, from the ovum. يعني the ovum after it get out, it starts secreting estrogen.
لا من الكربس.
دقيقة, no. I need from where it's coming. The question is clear. Source.
السورس يا
انتيريور بيتوتري.
فات تيشو.
What? From where? نعم. هنا I'm talking about just in this curve, not anything else.
From ovum.
From the ovum itself.
لا from
كربس نتيل.
oocyte. الفوليكل.
The follicle. الفوليكل is not the oocyte.
أنا كنت فوليكل.
لا دقيقة, follicle غلط.
ليش غلط؟
دقيقة. If you are talking دقيقة.
الأول صح.
If there is a follicle here, هنا the zona pellucida, you have granulosa and theca cells, صح؟ طيب. يلا from where estrogen is coming.
Granulosa.
First, this is the ovum here. The ovum, does it have any endocrine function?
لا.
The ovum is not producing anything. For anybody who write an ovum, is a wrong question.
دكتور أنا كتبت granulosa cell from follicle بين قوسين granulosa.
طيب حلو. يلا till when? All of it, is it coming from granulosa
كذا
cells?
صح دكتور.
دقيقة واحدة.
إيه.
Is it from here to here is coming from granulosa cells?
Yes.
I think the first one.
I think maybe the second period, like from the endometrium.
Endometrium.
لا 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 بالاروماتيز في فيكا سيلز في اروماتيز في الدي اي اتش اي hormone. It will be converted to estrogen by theca cells and aromatase.
اللي هو طيب اللي هو the source is still في corpus luteum. في second half of pregnancy is coming here is coming from the corpus luteum. Okay, لكن still if you remember we have two cells, two hormones. Okay, androgen اللي هو granulosa and theca cells. كويس. It's coming from granulosa cells. After aromatase enzyme it changed to estradiol.
لازم ترتب السيلز نفسها.
لا it's okay no. It's just we need to know about granulosa cells, the source of it. طيب that's concerning
Red line is FSH.
what?
FSH. Red line.
LH.
Red line. FSH.
FSH.
والبيربل الاتش.
دقيقة. This one.
No,
Red line. Red line. Red line.
Red line.
Yes. FSH.
FSH.
Yes.
طيب
والpurple line LH.
this
وطبعا both of them anterior pituitary.
anterior pituitary. Okay. طيب and this one
Estrogen.
estrogen. This one
LH.
LH.
Before ovulation.
Okay, LH before ovulation. Okay, that's it.
كويس يعني.
If you write that, that's okay. Yes.
طيب أول شيء اليوتراين contraction.
دقيقة خلاص. Yes. Yes. What did you write?
The uterine contraction.
Uh-huh.
Five.
5.
Uterine
واحد.
contraction.
طيب okay.
The baseline, baseline is about 140.
140. Okay.
Normal variability.
Normal variability.
There is a shoulder acceleration.
صحيح. شولدر هذه؟
Shoulder acceleration.
لا ما
في حاجة اسمها shoulder acceleration.
في deceleration.
أها.
Variable.
Variable deceleration. يعني ما في حاجة اسمها shoulder acceleration. Variable deceleration it has shoulders. Just if it has دقيقة. If it has shoulder then we say typical variable. If it doesn't have shoulders it's an atypical variable. Forget about it. Just
إذا في shoulder هل comment as a
no, just it's a variable deceleration and forget about it.
طيب دكتور بالنسبة هذا ممكن كأنه early
When?
deceleration.
Because usually it's associated with قلنا the only deceleration associated with acceleration complex, it's a variable deceleration. That's it. Why it's not? Yes. Clear?
Clear.
كل الناس واضحة متفقين؟
ما في اكسلريشن صح؟
No acceleration.
دكتور بالنسبة للسؤال اللي قبله الاستروجين عادي اقول فوليكولر ولا غلط؟
لا ما follicular. اوكي طيب. Yes.
combined contraception.
ليش مو فوليكولر؟
هذه عاد ما
شنو؟ It's coming.
الاستروجين.
Estrogen. It's not, you have to mention the source exactly. Then if it's follicular, we need to know what cells produce it. That's the question. Okay, then that's how we answer it. We didn't say it's
يعني الإجابة
from the granulosa cells of the follicle. It's not from the ovum. It's not about anything. Okay. What is this?
contraceptive.
combined contraception.
Combined contraceptive.
أنا هذا كنت أعرف ودي أعرف.
طيب.
إذا combine معناها it works about estrogen method, estrogen or progesterone method
طيب.
working and affecting endometrial wall.
I said the answering what?
المين ميكانيزم.
methods.
كويس دقيقة
Action
واحدة.
of method.
Before that, how could you know it's a combined pills?
هذا السؤال.
this is confusing.
Because of the number.
انا والله
No?
The number 28.
28. Progesterone only pills برضه 28. Yes.
اللون
Huh?
Two color.
It has 1 week cover.
Exactly. It has 1 week free interval. They're 21. These are containing the active ingredient.
اكتب ايش؟
Active hormones.
ايوه.
These are placebo. The white cells. Okay. طيب why they added this رو ما كان يخلوها فاضية just the 3 tabs the 3 lines
It's a
21
calculation.
prevent overlapping or
لا لا
Because so make calculation easier.
كيف يعني calculation of what
The days.
So the patient she forget or something.
exactly
But not really.
no it's not it's about increasing compliance يعني if somebody is every day she's taking pills there is no day off then she always خلاص she become used to increase compliance لكن if she's having 7 days not taking pills when she restart again she might start losing that's why they add this combination to increase compliance according to studies طيب outside the question what's the content of this placebo شو شنو
Starch.
vitamins mainly so usually iron supplement it's not meant to increase anything okay it could be ferrous fumarate or ferrous sulfate it's just it doesn't have any harm and then usually it may increase then each day she's going to take pill there is no pill free interval that's why to increase compliance of the woman طيب لو لقيتوا 21 tabs without this placebo it's a combined pills لأنه progesterone only pills they are going to be 28 with the same color the same size and placebo could be different color or could be different size
ايش هو اللي 28
progesterone only pills هم the same 28 you just calculate them if they all the same there is no line looking different then they are progesterone only pills
إذا كانت بلاسيبو
كيف؟
كشكل تقصد.
كشكل ايوه ممكن البلاسيبو ممكن تكون لون color ممكن تكون size يعني it depends what company produced whatever they like nobody depends on the color لكن they look last row different either shape or color okay اما you find them all of them 28 the same size the same color these progesterone only pills لانه مرات you could find only 21 tabs without placebo still a combined pills without pill free interval okay يعني ممكن تلقى 21 لو لقيت 21 only then it's a combined pills 28 with placebo it's a combined pill because active days is only 21 days okay طيب mechanism of action كتبت شنو؟
ما ما كتبت.
What did you write? Yes?
take care of the new.
The main mechanism of action number 1 if you put them in order أول حاجة what the most important way of
inhibiting ovulation
preventing ovulation is number 1 بعد ذاك
mucus thickening and endometrial thickening
endometrial thickening
Thinning.
thinning
وmucus-
mucus thickening endometrial thinning then even if the ovum get fertilized it's not going to get implant because the endometrium is becoming very thin okay بعد ذاك cervical mucus becomes thick then sperm cannot ascend in the first place okay that's why even it prevents pelvic inflammatory disease because if it make this cervical mucus thick even bacteria cannot ascend that's why just taking combined pills they are likely to develop upper genital tract infection cervicitis endometritis salpingitis clear طيب
الcomplication
contraindication
contraindication حطيت VTE
VTE
Breast cancer.
breast cancer
endometrial
وهايبر اكتف اوفاريان سندروم او
ovarian hyperstimulation ولا
ابر
liver disease.
لها اسم زي كذا ما بعد اخذناها لسه دي
polycystic ما اخذت
لا
طيب كاتبة
لا لا يكون البولس
اها
يكون
طيب
الاوفري سوبر اكتف يعني يكون اكتف اخذناها
كيف يعني
هكذا ovarian stimulation.
هايبر ovarian hyperstimulation
لا
هل تقصد انت
ايه
ovarian hyperstimulation will give you combined pills
لا كونترانديكيشن لا لك اعطيك
contraindication okay طيب because of
كوز اوف استروجين
طيب ليش because of estrogen because usually ovarian hyperstimulation more fluid go to the extravascular they are more likely to have thrombus formation That's why they have huge ascites. Then if you give them estrogen, then thrombus formation is common. Active liver disease, cardiovascular disease, CVA, having thrombophilia, these are all contraindication for estrogen. Okay, we see that. Okay, topic definition. Easy.
implantation.
هناك what's topic أخذتوها اليوم قال لي.
ما
طيب
تجاوب.
لا نو خلاص كفاك for the day. Yes. Exactly. Plantation outside the endometrial cavity. تمام. طيب risk factor for ectopic اذكر اثنين كتبت شنو؟ نعم؟ previous ectopic pregnancy تمام. كيف؟ نعم؟ anatomical يعني يكون شنو؟ shape of the uterus. طيب تاني
ذكرت واحدة كذا
دقيقة.
رقم واحد.
طبعا anyway
Smoking.
it's okay for IUCD it's going to be a big trick you might fall on it يعني مثلا لو جات في MCQ IUCD would you write مثلا pelvic inflammatory disease IUCD and whatsoever you're going to put IUCD as
لا بس هي ريسك يعني
like okay no actually IUCD if it comes is a very effective method of contraception okay what's the failure rate of an IUCD no? less than 1%. Okay? Then it prevents all pregnancies. If a woman is not taking any method of contraception, what's the chance of getting pregnant?
85%. 90%.
لا بس دكتور في الكتب مكتوب.
دقيقة واحدة شوي.
25.
هذا كيف دكتور؟ From one
In 1 month.
From one intercourse يعني
1 month, not 1 month having regular sexual activity. What's the chance of getting pregnant in 1 month?
100%.
No. حتى سنة is not 100%.
سنة كم يا دكتور؟ 90؟
سنة 85.
85.
Okay. Sana is 85%. Okay. 2 years, 92%. Okay. 1 month, what's the risk? 20. 20 in 1 year. In 1 month, sorry. Okay. Ectopic pregnancy less than 1%. Okay. For usually, ectopic pregnancy prevent all pregnancies, normal or ectopic. Sorry, IUCD. Then if IUCD failed, which is less than 1%, if it failed, most likely it's going to be ectopic. فعشان كده if you put it that way, actually IUCD protect against all pregnancies.
صح الجواب ولا غلط؟
يعني لو جات في ال MCQ look up exactly what they are asking. If it's written just because it increases risk of ectopic, it doesn't increase.
PID.
But even if they are talking about comparing with other لو ما في أي risk factors, then IUCD if it fail, then most likely it's going because it's going to be a very huge mistake.
I'm not sure but cervical cancer.
Cervical cancer?
أنا حطيت reversal tube ligation.
Yes, it's surgery, tubal surgery, whatever. Cervical cancer? No, it's not one of the.
PID infection.
Pelvic inflammatory is the commonest. Okay, what's the common infection?
Gonorrhea و
Which is causing pelvic ectopic pregnancy?
كيف يعني؟
يعني what bacteria causes more ectopic than others?
Chlamydia.
Chlamydia. Why chlamydia?
Moscow.
No, it's most common, but it's not because of that. What chlamydia does?
Toxins.
طيب التوكسين تعمل شنو؟
Inflammatory toxins will induce inflammation. This inflammation will cause destruction of the tube.
Okay, inflammation is going to destroy the cilia more than any other.
Yes.
Then if the cilia of the tubes being destroyed, then migration is not going to be efficient. Then that's why gonorrhea doesn't destroy the cilia like chlamydia. Yani chlamydia, even you could do hysterosalpingiography, you find tubes are patent. Still ectopic pregnancy is more common because the cilia, patent tube doesn't mean that tube could function normally. Still ectopic pregnancy is there. Type, management option, somebody with ectopic pregnancy. methotrexate واحد. surgical.
conservative.
Conservative. Type. For whom you do conservative?
إذا كان البيتا اتش سي جي declining with time
HCG declining في ليفل محدد
below 1000
below 1000. Okay, and the topic is less than
3.5.
3.5
centimeters. Okay, طيب methotrexate, whom we give methotrexate? Yes, out the scope of the question. methotrexate ندي منه نعم whom we give methotrexate? Yes,
medically stable.
medically stable يعني not ruptured ectopic. ثاني
No fetal heart.
no fetal heart. It's relative. Now what people do, they inject potassium chloride and still you can give methotrexate. طيب.
الكتاب ما ادري.
Okay, you are right still. Uh-huh.
less than 3 سنتيمتر.
less than 3 centimeters. Normal liver function because of the methotrexate itself. You don't give it for somebody who
normal
have
kidneys.
normal kidney because of the excretion. Yes.
bone marrow.
beta HCG
بيتا اتش سي جي
less than
ايوه less than
Less than
50.
50 less than 5,000.
Fine.
Okay, هنا 1,000 5,000. Okay, anything patient unstable rupture ectopic is salpingectomy. Okay, طيب what's engagement?
by parietal bone passing the inlet.
Okay, passage of the biparietal diameter through the pelvic inlet. This is the theoretical definition. How clinically we confirm it?
By the second pelvic grip.
Second pelvic grip type, this one. Usually that's what you do in the clinic in labor. Sorry, in the clinic antenatal care, like when you do obstetric examination. But in labor, how we confirm it?
we will not feel the head if it's fully engaged.
Vaginal examination in relation to scale spine أو rule of fifths. يعني in labor we do.
بس انت هنا سائل عن الستيشن ولا سائل عن الانجيجمنت؟
How clinically you confirm engagement?
مو الفاجينا اللي هو ستيشن؟
Exactly. Vaginal examination in relation to the scale spine.
يعني ستيشن.
Station. Okay. أو we could do how many fifths palpable per abdomen, and I can accept in this regard doing second pelvic grip.
صح.
أيوة صح. كويس. لكن mainly if she's in labor is different. يعني مثلا somebody came for antenatal care in the clinic. It's not acceptable to go doing vaginal examination to see if it's engaged or not. You can do either rule of fifths or second pelvic grip. Okay.
إذا كان fully engaged it will be how much?
What do you think for if it's fully engaged?
I'm asking.
اللي هو if rule of fifths then it's less than 1/5 palpable per abdomen. خلاص it's not palpable per abdomen.
يعني إذا كتبت إنه non palpable
not palpable per abdomen
right
معناته
answer.
fully engaged.
Right
Okay.
answer.
Yes. هي طبعا on examination below the scale spine if it's fully
So,
engaged.
بالنسبة للستيشن تكون كم؟
0 is engaged.
0 engaged.
0 we start saying engaged. لكن 0 it means that still you can feel part of it per abdomen. But if it become below 0 then you cannot feel it per abdomen.
وبير abdomen يكون كم اللي كان engaged؟
قلنا less than 2/5 palpable.
Yes.
Less than 2/5 palpable. Okay, طيب. What's the name of this
لا
course?
باقي آخر واحدة.
نعم؟ yes, okay. What prevents engagement?
انا صراحه
لا،
ما ادري بس
abnormal.
سفالو بلفيك
Abnormal lie.
سفالو بلفيك
Cephalopepled disproportion, yes. ثاني.
صح يعني سفالو بلفيك
بلاسنتا بريفيا
Placenta previa, yes.
ماكروسيفالي.
ايوه exactly. Cephalopepled disproportion. Big baby or small head. تمام. ثاني. Macrosomia. ثاني.
Fetal distress.
Fetal distress. Even he could be dead, he can get engaged and come out.
أنا كنت ما
لا, what could-
presentation.
Malpresentation, like transverse lie. It's not malpresentation.
لا.
Okay. ثاني.
مال بوزيشن
Malposition, like
بريتش.
malposition is not breach.
لا إنه الهيد not
لا, no. If you say something then relevant. Malposition is
اللي هو الترانسفيرس ترانسفيرس رايت اور ليفت اوكسيليتور
occipital transversalis. Okay, طيب. Usually occipital posterior because deflection happen in occipital posterior. لكن it's not that because babies could be delivered occipital posterior vaginally. Main thing, common things, pelvic tumors, pelvic kidney, okay, macrosomic baby, abnormal congenital anomalies of the pelvis, congenital double uterus. Okay, these are common things, and don't go to think that could be less. That's why I make it an open question. Then you're going to have a big range of correct answers.
لا 3 ولا 2 كان.
اي دكتور هذه اللي بيج رينج.
هذه البيج رينج خلاص تخاف.
الواحد يخاف منها لأن
لا it's okay. طبعا the main thing, the one thing just think logic.
صح.
اللي بيحصل شنو مرات people might think most likely they don't mean this. Then he ask another question, he answer it. Then you find a lot of people getting for the easy question, people get wrong marks, wrong answers. لأنه what happens, he leaves the question and he asks his own question and he answer it. Okay, for just think twice what's really meant. Yes, that's what prevent fetal head getting down. That simple. Then it could be even you try in contraction not efficient, or it could be the baby اللي هو power passenger and passages. Just that simple. Okay. Type.
What is the name? Bimanual compression test.
Exactly. This is bimanual compression. I intentionally brought it because I don't remember your
دكتور
thing.
هذه ذكرتها لما نقلت.
نعم.
ما كنت كذا. ماني متذكر الاسم.
Okay.
هذه وين اخذناها؟
الا
We talk about it like we didn't have a photo of bimanual compression. Type. What's the indication of doing bimanual compression?
استقبل بيبي.
What bleeding?
Intrapartum.
Intrapartum. Do you see baby here? This is for postpartum hemorrhage. هل كل البوستبارتم hemorrhage you do bimanual compression؟
لا.
إلا شنو؟ For what postpartum? Caused by what? Atony. لأنه لو كان if she has tear on the cervix or in the vagina, you are not supposed to do that, صح? Then usually if you find uterus not contracting, then you do bimanual compression to do that.
يعني البوستبارتم hemorrhage.
Postpartum hemorrhage for uterine atony in name. Okay, postpartum hemorrhage. We do bimanual compression. اللي هو the main thing, if you remember مذكرين الفيديو بتاع cesarean section, the uterus should contract immediately. If it fails to contract, you're going to have massive bleeding. This is the commonest cause. Then we do bimanual compression. قبل البانيال compression what we do?
مساج.
ovarian
مساج.
Uterine massage, ovarian. The bleeding is not coming from the ovary. Okay, then postpartum hemorrhage for atony. If it failed,
سنتوسينون ارجومترين.
Centosinon. I guess you better know the doses. Centosinon, 10 international units. Okay, anyway, it's not about. Or we can give ergometry if there is no contraindication. No contraindication, cardiac
respiratory
or hypertension. Okay? Or sometimes you can give prostaglandin F2 alpha. We can give it intravenous, intramuscular, or even intramyometry, or injected directly inside the uterus through the abdominal wall. We can give tranexamic acid. You are right. F2 alpha. اسمه carbobrost.
وبيلينش سيرجري.
We can do B-Lynch surgery. We can do ballooning, uterine artery ligation, internal iliac artery ligation, hysterectomy. There are a lot. That's why then if it failed, there is a medical, there is a surgical. Medical drugs, ergometrin, oxytocin, prostaglandin F2 alpha, even misoprostol. Okay. Surgical, you can go by conservative management, B-Lynch, or you can do uterine artery ligation, internal iliac artery ligation, conservative, not removing the uterus. If it fails, hysterectomy. You have to remove the uterus. Clear?
Clear.
Okay. Who scored full mark?
لا انا مو في المرة انا عندي غلط.
Okay. Then everybody knows where he is.
والله دكتور شوف هو